Politics and public health. Two essential ingredients in improving the health of the nation. Two perspectives, at times conflicting, on how to best move forward. The Surgeon General can be an important part of the nation's health system, serving as a voice for health for the nation, and serving as a reliable source of credible health information for the public and policymakers. Through the media and in definitive health reports, the Surgeon General can help translate complex scientific information and focus the nation's attention on critical health issues. To be effective, the Surgeon General must be able to speak the truth, even when it conflicts with the agendas of political officials. For this reason, the Surgeon General is appointed to a term that is independent of a presidential administration. But this does not mean that the office is immune from political pressure, and the history of the Surgeon General holds many examples of clashes between public health and politics. At its best, the Surgeon General has had a hand in saving countless American lives. However, Surgeons General have also struggled to preserve the essential independence that gives them their credibility with the American people.
I think I can sum up the intent of the Surgeon General in its job description: to protect, promote, and advance the health, safety, and security of the United States. Real simple on paper, but when you try and execute on that in a very hyper-partisan political environment, it becomes treacherous.
The Surgeon General is the doctor to the nation, a uniquely trusted figure who brings the best available science on matters of public health directly to the American people.
We need to discuss the importance of keeping the Surgeon General independent and free to communicate directly to the American people on disease prevention and health promotion.
The public expects that a Surgeon General will be immune from political pressure and be allowed to express his or her professional views based on the best available science. But when the science-based views of a Surgeon General are marginalized and ignored, that essential independence is lost.
The voice of the Surgeon General can be a powerful antidote to societal ill health. It should not be muted or filtered through layers of needless bureaucratic or political approvals.
I think if you go back to the earliest possible days of the office of the Surgeon General, there was a lot of meddling.
The office of the Surgeon General has always been challenged, okay? And it's changed over the years.
Just go back and look at Walter Wyman and San Francisco and the plague, the influence of the business community on whether or not the Surgeon General could call a quarantine.
This position emanated from the Act to Care for Sick and Injured Seamen in 1798. Surgeon General had absolute authority then. If you look back at all of the history, they were the chief medical officer. But as you start tracking it forward, you start to see more attempts at, well, why don't we let one of our guys go run this part or that part? You start to see that even though it's a uniform service, and that was the intent of Congress, politicians are reaching in early on, but not with the egregiousness they do today, and kind of just jimmy-rigging a little bit. Then we come to the late 60s, early 70s, where the Assistant Secretary of Health position is created, which is a politician who will oversee all of the enterprise. The political appointee who oversees the uniform officers.
The relationship between the Assistant Secretary of Health and the Surgeon General over the last 50 years has often guided the successes of each Surgeon General. Failure to build a strong relationship has made it at times difficult for the Surgeon General to enact his or her duties.
I think that we should think of politics as a tool like we have any other tool. There is a science called political science. We need to get much better at it.
Being both Assistant Secretary for Health and Surgeon General generally helped me in terms of navigating Washington, if you will. Having both positions, I obviously had more authority, more quote power, more resources than if I had been only the Surgeon General.
I think one of the things that we don't do as often as we need to is build relationships before you need them.
I'm more of a Lincoln-esque approach. you want a team of rivals. You want the person that's going to tell you that the emperor doesn't always have clothes on, that maybe there's a better way to do this based on the science. And again, the Surgeon General doesn't make policy, but you inform on policy, and because you're such a credible person, it scares people sometimes. But we should herald that. That's what a democracy is all about. Politicians can shade the truth left or right, and all the issues that you hear, whether it's abortion or global warming or all of those things. But the Surgeon General should come in and say, here's the best science we know today to help you all who are elected make the best decisions.
The White House refused to support federal legislation for funding of needle exchanges. It was an example of when it was difficult to be both Assistant Secretary for Health and Surgeon General. As Assistant Secretary for Health, I was expected to support the administration's view. I was a part of the administration. As Surgeon General, I was supposed to speak directly to the American people based on the best available public health science. So it allowed me to leave that office that day and go out and talk about the value and talk about the research that we had done showing this. And my understanding is that many localities and states then provided funding for needle exchange program, and many still do.
There's a difference between the politics at the national level and the local level in many ways. I remember as both a city health commissioner in DC and then of course at the state level, there was a much more feeling of ownership of the policymakers in the community. And I felt, regardless of what political side on an issue people were or what political party they were, you could go in and have a real confidential discussion with them because there seemed to be a lot more ownership of the community. At the national level, it's much more dispersed. And so you have politicians who may not necessarily have ownership of the community, but they have ownership of an issue. And it makes it more challenging at the national level.
It is a judgment of the committee that cigarette smoking contributes substantially to mortality from certain specific diseases and to the overall death rate.
The Surgeon General's report is perhaps the most well-known aspect of the Surgeon General's duties. By speaking frankly to the American people, Surgeons General like Luther Terry, whose landmark report linking smoking to lung cancer was released despite the opposition of powerful tobacco interests, and C. Everett Koop, who broke ranks with a conservative administration to begin a national dialogue about HIV/AIDS, demonstrated the power the office can hold. When releasing certain controversial reports, it is up to the Surgeon General to be politically savvy to get the scientific findings out to the American public.
When you have a Surgeon General's report, it has to be vetted. So people at HHS look at it, people at the Department of Defense, people at the White House, and they send it back to you. And so where we made some very emphatic statements, we'd have remarks like, well, can't you change that word? That's a little too harsh. And I say, well, no, it's not. It kills. It really does kill. Yeah, but you have to say it that way. Yeah, death is death, okay? So, but people try, because of their particular vantage point, who they represent, the special interest groups are calling the White House and saying, you can't let that go out. It's unfair. It's really not as bad as the Surgeon General says. And I'm not saying it. I'm the spokesperson for all of these researchers who have devoted years of time to help us put this report together to affect health policy.
Our recommendation, of course, was that the administration support federal funding for needle exchange. Well, the decision of the White House was not to support those. They never said, you guys are wrong about the science. They just said, we made a decision not to support it. The decision of the White House was not based on the same thing, the decision of the Surgeon General.
The Surgeon General should lead in the areas that the Surgeon General has chosen as his or her areas of priority. I also think that the Department of Health and Human Services has to support the Surgeon General much more in that mission. And we've had times when there's been an enormous amount of support, and we've had times when there hasn't been support. And we've also had times when we've had a Surgeon General who is politically wise and very crafty, and C. Everett Koop, of course, is a role model for that, and learned to work the system, so to speak, to improve the public's health.
He had very strong scientific support for what he wanted to release. There was some friction within the administration. We don't know how strong it was, We only know that he was ultimately able to send letters to the homes of all of the American people talking about this disease. And he said in it, I know it's not easy to talk about how one gets AIDS, but we must do it. He found a way within the context of what was supposed to be a conservative administration to get that out. And I would describe my experience in a very similar way. Not that I was supported by the White House in everything that I did, but finding a way based on the best available science to get the message to the American people.
The Surgeon General should always strive to tell the truth based on the best science, because the Surgeon General is not there to appease either party. You're there to bring the best science forward. So whether it's stem cells, abortion, guns, all of those hot topic, volatile issues, tell the truth.
You're going to have political meddling, and any job, right? There's always office politics. And I always talk about the fact that medical politics, you go to an academic center, health center, those are the most vicious politics that I've ever seen. We could teach those folks on Capitol Hill a lesson in politics in academic health systems.
Obviously, I think we need a strong person in that office. I think we have one in the new Surgeon General, Vivek Murthy. And I think different surgeons general have been strong in various ways. I think Dr. Benjamin was strong in implementing the prevention agenda component of the Affordable Care Act. And I think that was important. Now, what Congress did was to take the money. There's no defense against Congress deciding not to put money in the budget. They couldn't change the fact that there was a prevention agenda which Dr. Benjamin had developed along with her colleagues, but they could take the money away.
There'll always be political meddling, but we want the position to be protected, that you can't be marginalized because you give an opinion contrary to, say, the administration in power. The examples we use is Federal Reserve or the Supreme Court. They can say what they want, and they're in there, okay? And you may upset the political power that's there, but this is the way I interpret the law. The Federal Reserve, they comment on monetary policy, okay? It may upset a sitting president or a senator or congressman, but nothing happens to them. Their budget doesn't get cut. They don't get marginalized. Why is the Surgeon General different? Why is the health of the nation not as important as all of those other entities?
It's clear, if you work in an institution, people are going to try to drive your agenda in terms of things that you do. And for some of that, you've seen people say, well, that's where the political process is. So when the Surgeon General is not allowed to talk about women's reproductive rights or climate change or those kinds of things, that's a muzzling that occurs. And I don't agree with it, but that's going to happen in the institution, and Surgeon Generals have got to figure out how to get around that. Coop was able to do that with HIV/AIDS. I've not seen any evidence that the Surgeon Generals have compromised the science base of their message, although people have tried to control the messages or the topics that they talk about.
Even the appointment and confirmation of the Surgeon General can be the subject of partisan debate, leaving the office vacant for extended periods of time.
Dr. Coop, as you well know, while I was initially very skeptical about your nomination when President Reagan put it forward, I was wrong, and I've come to know you as a professional dedicated to the public good and public health. You had the courage to speak truth to power and the good sense to distinguish public health from politics, and I learned to admire you and to enjoy working with you over the years on tobacco, on HIV, and children's health.
First, let me say that Dr. Murthy's confirmation process was difficult. As I said to Dr. Murthy when he was struggling with his confirmation, just because your confirmation is difficult doesn't mean that being Surgeon General is going to be difficult. In some ways, it's going to help you because you've had to work through a lot.
And it was interesting when I spoke to both sides of the aisle, especially on the Democratic side of the aisle, with senators that I knew, many of them did not know what the process was. Many of them were not aware of the public laws that talk about how the Surgeon General evolved and why it's a uniform position and all of that.
There are many different officials in the federal public health system, and though they all work together, each plays a distinct role. Many are charged with implementing the president's agenda and administer programs established and funded by Congress. The Surgeon General is the only official whose term appointment is independent of a presidential cycle and is therefore in the best position to speak to the science independently of political agendas.
I expect to have continued political meddling in a democracy. But the person that's telling you the truth based on the best science on that day should not be marginalized or discriminated against.
Politics is a part of public health. We like to pretend like it isn't, but it is.
Make sure it's budgeted appropriately, and make sure that the person is relatively protected so that when they render an opinion that might be contrary to ideology or politics, that there's no repercussions for that. Surgeon General, we appreciate your opinion, but we're going to do something else. That's fine. That's the political process. So that's what I think would be best for the American people and the world.
I don't think the office is in trouble necessarily because there are frictions between the Office of the Surgeon General and the White House. There have always been, there always will be. If the White House begins to stand in the way of the science, the public health science, then I think the office is in trouble.
I don't think the Surgeon General has lost being the top doc. I think that on issues that when they rise to prominence, people want that trusted voice. I think that each of the Surgeon Generals in their own way for certain agenda items were the trusted voice.
I believe that there is a dynamic relationship between the Office of the Surgeon General and the rest of the administration, including the White House. I think basically it's a healthy relationship. As I've said many times, it is the responsibility of the Surgeon General to speak directly to the American people based on the best available public health science.
We're not the Surgeon General of the Republican or the Democratic Party. We are the doctor of the people of the nation. And just as we treat our patients, we have the biggest practice in the world now, over 300 million people, and we have to always evaluate the science and give opinions as to what is best for the greater good of the nation and its people.